Hello dear viewers, this is Dr. Uttam here. In this video we will discuss about uterine torsion in buffalo, its causes, clinical sign diagnosis and its management. So what is uterine torsion? Uterine torsion is the revolution or twisting of the uterus on its longitudinal axis. So it was first reported by Bertolli in the year 1766. Uterine torsion is most commonly reported in case of cattle and buffalo. There are certain causes which are predisposing for cattle and buffalo that we will discuss in the next slide. Apart from that, uterine torsion is also occasionally reported in mare, sheep, goat and sea dog, while it is rarely reported in case of pig. Among the buffalo breeds, it is most commonly reported in case of surti due to their wallowing habit. If we talk about the age group, it is more common in case of Paris animal as compared to the heifer. Now we will know about the different causes of uterine torsion. The first two causes lies in the anatomical arrangement of the uterine and other structure inside the body of the bovines. See, in case of bovine, this greater curvature of the uterus is free. It is not attached to the broad ligament, while the lesser curvature of the uterus is attached to the broad ligament. So it makes freely movable part in the abdominal cavity. The second thing is that cranial part of the uterine horn, it is also not attached to any of the ligament. So these two are the destabilizing factor at the late gestation of the animal. This calf, it is either lying in the left side or right side, so it makes asymmetry, or one side it makes more heavier and bulkier. So this is the predisposing factor in case of bovines, that why it is more reported in case of cattle and buffalo. Apart from that, the manner in which cow lies down and get up also predisposed for uterine torsion. She always get down on her knee first. While standing, she elevate her hind quarter first. So this makes the longitudinal axis of the uterus more prone to be rotated either left side or right side. Apart from that, partial attachment of amniotic sac to the coriolantois in bovine predisposed for uterine torsion of the uterus as a result of violent fetal movement. And the next is the confinement in the stable for longer period of time, hilly region, malnutrition which may also cause weakness of the ligament and lack of uterine torsion. Now we will discuss about the different types of uterine torsion or its classification. So on the basis of site, it may be pre-cervical or post-cervical. If the torsion is in up to and before cervix, so this type of torsion is called to be pre-cervical torsion, and if this uterine torsion has extend beyond the cervix up to the vagina or anterior part of the vagina, it is called as post-cervical uterine torsion. Among these two categories, most commonly reported are the post-cervical type of uterine torsion. Based on the degree of rotation, it may be 90 degree, 180 degree, 270 degree or 360 degree if it has turned full. Now on the basis of direction of the turning of the uterus, it may be right-sided uterine torsion or left-sided uterine torsion. So among these two categories, the uterine torsion is most commonly reported is right-sided uterine torsion. The reason behind is that right ovary is more functional in case of bovine. So right pregnancy will be also there more. Apart from that, in the left side there is rumen which prevent the left-sided uterine torsion. So these are the three causes which prevent the left-sided uterine torsion and causes more right-sided uterine torsion to occur. These are the clinical signs associated with the uterine torsion in case of animals, like there will be severe pain in the abdomen, there will be grinding of the teeth, animal will be restless, she will be in a aerobic condition, taking less feed and water, there will be lack of rumination, there will be vulvar edema, swelling, animal will be straining but further no progression will be occurring, there will be no delivery of the fetus. Apart from that, the arrangement of the mammary gland or the udder will be disconfigured. This is the normal. This is not the normal you can see in the picture. And if the torsion is more than 270 degree, there will be changes in the vulvar conformation. If the uterine torsion is of the right side, so you will see that there will be upward fold in the left side and downward fold in the right side, if it is right sided uterine torsion. Apart from that, if this uterine torsion is more than 360 degree, there will be compression of the lumbar vertebrae in case of buffalo. Basically, this uterine torsion is the complication of the late first stage and initial second stage of the labor. In advanced cases, uterine torsion may lead to the death of the fetus. In delayed cases, this fetus may be emphysematous or macerated. And also there may be rupture of uterus in vagina, gangrene of the uterus, which may ultimately lead to the shock and death of the animal. In the diagnosis part, there are certain criteria, this certain point which we can consider for diagnosing a case of uterine torsion, like history of the case of prolongation of the stage of parturition. If it is more than 12 hours, yes, we can suspect for case of uterine torsion. In per-rectal examination, we can look at the broad ligament. If it is right-sided uterine, so see, this is the normal positioning of the uterus. This is the vaginal part, this is the rectum, this is the broad ligament. If uterus is rotated towards the right side, so you will see that there will be fold in the depression in the broad ligament in the right side. And if it is left side uterine torsion, so you will find a depression in the broad ligament in the left side. Apart from that, on per vaginal examination, if you could palpate the cervix, it will be pre-cervical torsion. If you are not able to go up to the cervix, yes, you may consider it post-cervical uterine torsion. Based on the degree, if your one hand can be passed to palpate external os with some resistance, it will be less than 90 degree. If only one finger is passing, it is 90 to 180 degree. If one finger with severe abdominal pain is occurring, it may be more than 180 degree. And if there is abrupt stenosis of the cervix or the genital tract, it may be more than 270 degree. Apart from that, any case of uterine torsion, we should do some differential diagnosis. We should rule out indigestion, traumatic gastritis, intussusception and pyelonephritis. Then after confirming the case of uterine torsion of either post-cervical, right or left-sided, we should go for treatment. So its treatment includes manual detorsion per vaginal in combination with external pressure on abdomen. In mild cases, these two can be done, while in case of severe rotation, there are modern methods like detorsion by simple rotation, Schafer's method, modified Schafer's method by Sharma, and caesarean section as the last option. So in case of Schafer's method, a plank size of 12 feet long and 10 inch in width is taken across the paralumbar fossa to fix the uterus. This assistant will be standing on the pressure, then dam will be rolled in the direction of the torsion. This works well in case of cattle. However, there is limitation that this plank may slip on the thick skin pendulous abdomen of the buffalo. We should go only for up to 1 to 3 rolls. While in the modified Sharma's method, which was modified Schafer's method, which was a modification given by Sharma, in this a plank size of 11.9 feet and 9 inch wide and 2 inch thick is taken. This is larger and heavier plank, and it also provides more assistance for stronger fixation. It prevents skidding on buffalo's thick skin and heavy abdomen. It also provides greater pressure and stability during rolling. Ideal for buffalo and heavy late gestation animal, more controlled, higher detorsion success. If it is also unsuccessful after 3 roll, we should go for surgery. So this is the brief video that we have corrected a case of uterine torsion in our polyclinic. So this is a brief video that you may see. First we will cast the animal on the ground by applying some rope in the forelimb or hind limb of the animal. Then we will take her on the ground. So this you can see how this rope is applied and how this animal is taken to the ground. After we have taken animal to the ground and casted, now we will prepare the animal for detorsion. We may apply some lubricant like CMC or paraffin on the paralumbar fossa. Then we will tie both hind limb as well as forelimb. Then we will fix the plank on the paralumbar fossa of the animal. Then one person will be fixing this cervix from the backside of the animal. Then 3 to 4 person on each of the leg will be there. Then quickly we will perform the rolling of the animal. So this is how we roll the animal, and after that we will check the uterine torsion whether it is occurred or not. If it has not come to the normal position, we will do again 1 or 2 more rolling. These are the sequelae of uterine torsion, like it in delayed cases, or if it is not treated, it will lead to peritonitis, internal bleeding, retained placenta, septic metritis and perimetritis.